Hi, I'm Dr. Kia Movassaghi. Welcome to Movassaghi Plastic Surgery and Ziba Medical Spa. My friendly and experienced team is here to provide you with the best and most confidential care possible. I did my entire training at Harvard Medical School, including my plastic surgery training, but I am very proud to call Eugene my home with my beautiful wife and my 2 sons. Here at Movassaghi Plastic Surgery and Ziba Medical Spa, we provide the entire spectrum of plastic surgery with great expertise. On the non-surgical side, we provide skincare, facials, skin products, as well as some of the most advanced non-surgical treatments such as CoolSculpting for body contouring, Excellus for skin tightening, and NeoGraft for hair restoration. On the surgical side, however, we offer the entire spectrum of the surgical treatments, from facial surgeries to nasal surgeries to breast and body contouring procedures. From the moment you walk into my practice, my team is here to welcome you and take you through your consultation process. We will answer all your questions, we will explain the procedures to you, and will help you to manage your recovery. I am excited to have you at Movassaghi Plastic Surgery so I can share with you my expertise in some of the most advanced cosmetic procedures. Number one thing for me that's important is to hear from patient what is it that they're concerned about. And I give them a mirror, they look in the mirror, and they talk to me through the mirror. And by listening to them, I get a sense of where they want to go. And then the next thing is I ask them, show me how much improvement you're looking for. And if they go in front of the mirror and then pull on their neck or pull on their face, that also gives me a hint of what they're looking for. I have different tier of surgery for different issues. So I call what I call a level 1 lift, which would address only issues with the neck, followed by a level 2, which would be the neck and the lower face, and a level 3 would be neck, lower face, and the upper face. And I tell them the pros and cons of each, and some patients are only candidate for one type, and some patients are candidate for all 3, and I give them the pros and cons and let them decide. So I have a way of customizing the treatment plan to the patient's needs. I can offer them treatments from the spa side, I can offer them treatments from injections, lasers, technologies, and I can also offer them treatments from different tiers of surgery. If anybody tells my patients, who did your facelift, it's an insult to me. To me, they say, did you lose weight? Or are you sleeping better at night? So you don't have bags underneath your eyes. People should not know somebody had an operation or any procedure done. Rather, they should say, you look refreshed, you look better. Mommy makeover. It's sort of restoring what you had before you had kids. For most women, is their breast after breastfeeding and maybe perhaps losing some volume in their breast and the abdominal area. With the tummy tuck, obviously, it's a very powerful technique. It gives the patients the most ideal location for the scar. So a lot of my patients wear a bikini. The way I tighten the skin, it pulls their skin of their legs up. So a lot of times my patients say, wow, I got a little bonus thigh lift out of it, even though that was not even the purpose of the operation. It gives the best possible looking scar because of the way I close the skin. I do a lot of liposuction at the same time, which is not possible with other techniques of tummy tuck. And it's not safe with the other techniques, but with my technique it is. After the initial 2 months of recovery, go get a trainer, get a physical therapist, somebody who can coach you to make that connection from your brain to your muscles that has been turned off for many years. And that's the key for my patients. I really emphasize that for them. CoolSculpting is a great technology. I love CoolSculpting. CoolSculpting is not a surgical procedure, so the outcome cannot be guaranteed, number one. Number two, the CoolSculpting works by freezing the fat, and that freezing energy that we talk about only penetrates the top portion of the fat layer. So if you have this much fat, you only penetrate that much fat. So plan on doing multiple procedures. But the upside of it, CoolSculpting, is no surgery, no downtime. You do it, you go back to work out that day or whatever. As a matter of fact, I did my love handles, and I did it, and half an hour later, I was riding my bike. So that's the beauty of CoolSculpting. CoolSculpting is great for unwanted pockets of fat. I prefer CoolSculpting to just liposuction alone because CoolSculpting will have less problems with irregularities of the skin, whereas liposuction, it could leave the skin with irregularities.
Excellus is one of our favorite technologies in the office. It is a non-invasive comfortable treatment where we're using intense heat, but still comfortable. And what this is doing is it's stimulating collagen in the skin. So what you see from it after your series is a firmer, tighter, healthier skin. It's great for those people that are starting to see those early signs of aging and they just want to slow it down just a bit. With Excellus, you see your final result 4 months after the series is finished. And if you're happy with your results and you're wanting to maintain it, the best way to do that is to do one treatment every 4 to 6 months just to give your skin that nice little extra boost. And it can maintain for years at that rate. If you choose not to do your maintenance treatments, you're going to really see your best results for the first 18 months to 2 years. And generally people have come back and wanted to continue with it after.
We offer hair transplantation, which is not just for men, but both men and women. But we have invested in a great technology called NeoGraft. A lot of men are coming in for non-surgical facial rejuvenation procedures, hydrofacials, skincare, and Botox and fillers. And men are also finding a great need for that because they want to feel good about themselves and look good because of what they do at work. CoolSculpting, they love that. We do a lot of male patients who come back for repeated treatment to get rid of the unwanted fat without having any downtime. Gynecomastia treatment, the treatment of large breasts in male, is also a very big part of my surgical procedures. And a lot of men are becoming more and more aware because they want to be active and, you know, swim or take their shirts off in the locker room. And a lot of them are self-conscious. And a lot of folks even have concern with, you know, having a relationship, starting a relationship with somebody. Anybody who comes in for a surgical procedure, once we schedule the operation, during my preoperative consultation with the patient, I emphasize with them that even though this is cosmetic surgery, this is plastic surgery, elective surgery, the body is not going to know the difference. The body is going to heal the same way. So do not underestimate recovery with this operation. Do not think, well, since this is just a cosmetic surgery, I can just get up the next day and go about my business. No, your body's still going to feel the trauma that it goes through. Therefore, you have to allow the body to heal. And I always tell my patients, the folks who are not stressing their bodies and their mind in that process, they recover the fastest. One of my most favorite part of the practice is my breast cancer patients who come in for reconstruction. First of all, it's an honor to take care of them, to be part of that journey with them. And number two is just they're such a wonderful group of patients. They're very, very appreciative. And I can offer them a lot to regain that self-esteem that they lose by going through the cancer treatment. I help the general surgeons in town who perform the mastectomies to create what we call a tumor board. So I go to the tumor board. I'm part of that team that makes plans for these patients. So we have oncologists, we have surgeons, we have radiation folks, and we all talk and figure out what would be the best treatment course for the patient. And at the time when they do the mastectomy, I make sure that I am present and I perform the first portion of the reconstruction because the goal is to preserve the beautiful skin of the breast. Skin of the breast is like the skin of your nose, your eyelid. It's a very specialized skin and it's hard to recreate it. So therefore it's important to save it because then we can figure out what else to do. And that's part of the biggest part of changing the way we do breast reconstruction in this area, not only just the country, but also in this area. The way to think about reconstruction after mastectomy is in two ways. One is reconstruction with what we call implant materials and implant-based reconstruction, or alternatively reconstruction with their own body tissue. And there are pros and cons with both. 85% of folks in this country get reconstruction with implants. Why? Well, it's easier, it's faster. There is no donor site in the body, so you don't have to sacrifice any other part of the body, any scar anywhere else, any function of the body, because some of those operations require taking muscle and skin, and you compromise, function. So you bypass that part. And number two, the advantage of the implant-based reconstruction is, if you don't like it, you haven't burned any bridges. You can always go back to your own body part. But if somebody wants a body part reconstruction, then there are options for that as well. Bigger operations, bigger recovery. The advantage of your own body tissue is obviously you don't have an implant in the body, so there's no maintenance of the implant. But with the implant reconstruction, I always tell patients these are not meant to last forever. and there's going to be some maintenance involved in the lifespan. But all the implant-based reconstructions, all those operations are outpatient, faster recovery, and faster going back to life. I am essentially the light at the end of the tunnel for them to help them restore that self-whole for a lot of these folks. And I'm just honored just to be part of that process. And you know what, they get to see their general surgeons once or twice and that's it, but they get to see me for years. And I really bond with these patients. And that's why it really excites me when I see them and that we get to know each other on a first name basis, and it's just an amazing process to go through with them.
We carry the SkinCeutical line and the Zio Skin Health, which is Dr. Obaghi's newer line. Between the two, we really branch over everything from just a good basic line, going into retinols, vitamin C's, and your more advanced skincare as well.
An integral part of any cosmetic practice is to have a spa side to the practice, because the spa side truly complements what the surgical side does.
We are rated #1 in the area in the services that we provide, both in our medical spa and with the cosmetic plastic surgery side of things as well. We cover everything from a hydrofacial and good skincare on into our lasers, our Excellus and CoolSculpting, and then injections, resurfacing, surgery. We pretty much have everything you need here. We have a wonderful new laser in the office, the Clarity. What this has done is it's allowed us to treat more and do it more comfortably. So we're able to really address pigmentation in the skin. The spots, the little cloudy spots, hair removal is a lot more effective and a lot more comfortable. You're looking at about 6 treatments for your final reduction as opposed to 9 to 12 with previous technologies. It is also a wonderful technology for treating redness, whether it's rosacea and something that you're having to manage more over time, or little spider veins and tiny bits that everybody's got some of.
Very fortunate to be where I am, where I live in Eugene, Oregon, and also what I do for a living. It brings the best out of me in terms of bringing all my skills, but also being in Eugene has allowed me to enjoy the outdoors. Picked up triathlon about 10 years ago, and I've done it and I really enjoy it, biking, swimming, running. I'm also fortunate that my kids have grown up here and they're also into athletics, and I kind of like to call them the sport junkies. We're also fortunate to be in a university town, which brings a lot of culture to the area, and we try to be as engaged as possible. For instance, my wife is on the board for the Oregon Cancer Foundation. It's a topic that's dear to us, and we're very involved with that to help some folks in our community. Overall, I think we are very fortunate to be where we live.